Hi, my name's LaurenKelly and this is my literature review regarding postural instability and falls in people with schizophrenia. It is well documented that those affected by serious mental illness can suffer from an increased risk of falls and fractures, and the purpose of this review is to find the clinical correlation between postural instability and schizophrenia and find any successful exercise interventions that aid in creating postural stability, core strength and joint strength in this population. Firstly, what is schizophrenia? Schizophrenia can be described as a brain disorder that represents with disordered thinking and psychosis, where the affected individual experiences delusions, hallucinations, and they see real life experiences in a distorted way due to false beliefs. They're also known to have an increase in involuntary movements and postural instability. The methods that I use for this literature review, the databases were EBSCO host, ScienceDirect, PubMed and Google Scholar, and my search parameters included only peer-reviewed full-text journal articles dating in the last 10 years. My search terms that I used were varied as I wanted to get a really good idea of the amount of research that was out there, and they can be seen on the screen as follows. This review covers 17 current peer-reviewed studies, 10 of them discussing the reasons and correlations for postural instability, and 7 of them examining postural sway or postural instability and or the exercise interventions. So what did the studies report? As far as the brain source of schizophrenia, there seemed to be a couple of schools of thought. One of the studies stated that 2 areas of the brain seemed to be affected in this disorder, the prefrontal cortex and the basal ganglia. Another study agreed with basal ganglia involvement, but also stated that cerebellar dysfunction would be a likely cause, and the cerebellum theory is backed up by other researchers also. So why do schizophrenic patients exhibit postural instability? Basal ganglia interruption, as we talked about, loss of grey matter, increased dopamine levels, oxidative stress and cell damage or death, anxiety and modifiable life factors were some of the reasons that I found that schizophrenic patients seem to suffer from postural instability. Exercise interventions. There was a lot of research conducted on how general exercise was beneficial to the schizophrenic population, such as cardiovascular exercise and general strength training. With the exception of one paper by Ikai et al. In 2013, they were very specific about yoga intervention for postural instability. I didn't find a lot, and the closest link I found was between yoga and schizophrenia and dance and schizophrenia, because both exercises, yoga and dance, are commonly known to strengthen your core, improve your posture, flexibility, balance, and joint strength. So what do these findings mean? Let's discuss. Looking at the brain scan picture, you can see the decreased activity in the prefrontal cortex, that's the blue shading in the top figure, and the excess activity in the basal ganglia, that's the red in the bottom figure. So this comes from a study by Yoon et al. In 2013. And he stated that the combination of decreased brain activity in the prefrontal cortex and a high level of activity in the basal ganglia leads to ineffective communication between these 2 areas. And the greater this functional disconnect, the more symptoms are apparent in the patient, both physical and mental. Now, the prefrontal cortex is in the frontal lobe and it's responsible for personality and cognitive behaviour. The basal ganglia regulates movement and coordination. So if this area is affected, balance and coordination will definitely be an issue. In a study by Kent et al. In 2012, they also suggest that specific pathways in the basal ganglia, mainly involving the striatum, underlie gross movement abnormalities such as muscle spasms in the schizophrenic. Additionally, Kent also found that cerebellar dysfunction in schizophrenics caused postural sway and affected eye movement. So this would of course affect balance and postural stability as well, and increase the risk of falls and fractures. The cerebellum regulates and coordinates posture, balance, gait, and it also results in a balanced muscular activity and a beautiful smooth gait. In an earlier study on autism by Carper et al. In 2000, an inverse relationship was revealed between the frontal lobe and the cerebellum. So this might explain the varying schools of thought in this discussion, that there is actually a relationship. The hallucinations and delusions in schizophrenia are well documented to be due to the increased subcortical release of dopamine into the brain. This can cause excess bodily movements, balance problems, abnormal gait, and a postural imbalance. Sanders and Gillig in 2010 state that gait can be a reflection of nervous system functioning, as gait reflects the integrity of higher brain systems. Gait, postural instability, and turning problems are extremely likely in those with psychiatric disorders. These problems are caused not only by the communications in the brain and the increased amount of dopamine in the brain, but also significant loss of grey matter, up to 25%, especially found in the temporal and frontal lobes. These issues can further be exacerbated by the patient's age, also by their fear of falling, restlessness, the effects of antipsychotic drugs, and also the shifting effects of hysteria. In a study by Matsura et al. In 2015, results show that schizophrenic patients exhibited difficulties in integrating visual information and proprioceptive signals, and their anxious behaviour that they're more prone to anyway just simply made their postural instability even worse. Another study by Kishimoto et al. In 2012 revealed that reduced exercise, along with poor nutrition, smoking, alcohol, and decreased vitamin D levels can further increase the risk of fractures and falls due to weak core and joints, and also general poor health overall. An interesting study to note is one on the body's inflammatory and immune response to certain brain disorders. Lisa et al. In 2015 state that both brain and peripheral cell damage have been shown in schizophrenic patients as a result of oxidative stress. The brain is often considered an immune-privileged organ due to the presence of the brain-blood barrier. However, it's being shown now through evidence that inflammation within the central nervous system is directly related to many degenerative processes, including psychiatric diseases such as schizophrenia. Exercise interventions. Yoga is well documented to help improve posture and core strength, strengthen joints, improve balance and bone density, increase circulation, lymphatic drainage, and improve overall musculoskeletal strength. Recent studies have started to examine the effect it has on psychosis and schizophrenia, and its use as an add-on therapy. The most specific intervention study I found was one by Akai et al. In 2013, which found great improvements in total length of trunk motion in an 8-week yoga intervention. Although beneficial postural stability effects were seen, the therapeutic effects on postural stability were transient, however, so more study is warranted on the topic. All the other studies that I looked into all basically showed the same sort of thing, just general physical improvements in health and well-being, and it was beneficial to stress levels as well. An interesting study by Kultz et al. In 2015 was on the effects of Greek dancing on the functionality of schizophrenic individuals. Walking tests, sit to stand tests, and isometric lower limb strength tests were completed on the participants, and there was functional and strength improvements seen all round, in particular to the lower leg maximal isometric force. In conclusion, the review concludes that the schizophrenia stems from either the frontal lobe and basal ganglia, or perhaps the basal ganglia and the cerebellum are responsible. An inverse relationship is most likely. Grey matter in the frontal and temporal lobes can further exacerbate the functioning of the patient. Outside of these different schools of thought, the clinical correlations as to why schizophrenics have postural instability seem quite consistent. Gait and balance seems to be affected by neurological imbalances and inflammation, with the severity of these symptoms increasing due to various lifestyle factors, anxiety, and fear of repeated falls. Although a lot of literature was found on general exercise being beneficial to schizophrenic individuals, yoga and dance were the only specific style of exercise found. What lacked with these studies further, though, was specificity, particularly to those exercises that would aid in the reduction of falls and fractures. For example, postural stability exercises, core strength, and joint strength. More study is required into testing joint and core strength and specific yoga postures that improve posture, balance, and stability. Thank you so much for watching.